Hello, everyone. Welcome. Thank you for joining us for this session today. Before we get started, I got a few ground rule things to talk about, information about WLA. So my name is Krishna Horrigan. I work at the Westchester Library System in outreach, but today I have my Westchester Library Association hat on. I'm one of the chairs for the professional development. I am one of the professional development chairs. My co-chair, Megan Fenton, was not able to make it today, but thank you everyone for participating in this, this final professional development program for the year. We are looking forward to next year. We have a few surveys that we've sent out. We've sent a survey out about programming ideas and needs for relating to diversity, equity, and inclusion. I will put the link to that again in the chat here. And we appreciate any feedback we can get on that. We're trying to put together the most valuable programming we can for next year, and any input that we get from you guys is really valuable. WLA registration is open again, so if you are a member, then make sure you re-register. If you are thinking about joining, then now is the time. You can talk to your organization administrator too to see if you have a organizational membership. And what else? There's a feedback form that we've been sending out after each program. I will send that out into the chat at the end of this meeting today. I also, for questions, there will be a Q&A at the end. Questions are welcome throughout, but please, during the presentation, leave yourself muted. You can send questions into the chat and we'll address them as they come up. And feel free to save questions for the end as well. So today we have Alyssa and Alyssa joining us from NewYork-Presbyterian Hospital. Everyone knows what they're going to be presenting about today. So without further ado, I am going to pass it over to Alyssa. She'll give us a bit of an introduction to NewYork-Presbyterian. And I think you are muted, Alyssa.
Yes, of course. Thank you, Krishna. And we're very happy to be partnering with the Westchester Library Association today to provide what I believe will be an exciting program that will be most helpful to all of us. But before we hear from our featured speaker, I'd like to tell you a little bit about NewYork-Presbyterian Lawrence Hospital. Well, I don't quite want to see my featured speaker quite yet, but let's go back. Okay, my apologies. Thank you, Krishna.
Not a problem.
Okay, folks. NewYork-Presbyterian Lawrence Hospital, of which...
Sorry, Alyssa, we've lost the presentation.
Oh, my apologies.
If you could share that again.
Okay. I'm sorry, everyone, for the technical issue here. Okay. All right, folks, I apologize.
Perfect.
Alyssa Klein and myself are with NewYork-Presbyterian Lawrence Hospital based in Bronxville, and I specifically work in community affairs, and we're very proud to be partnering with the WLA with respect to this presentation and other community organizations. For those of you who don't know, Lawrence Hospital has been around since 1909, and in 2014, part of the NewYork-Presbyterian family. Since then, we've seen an addition of doctors, surgeons, researchers, access to clinical trials, and other programs. So our new relationship with NewYork-Presbyterian, frankly, is a major benefit for the local community. We have some certifications and specialties we're quite proud of. We are a Commission on Cancer certified cancer center, and that is located on our ground floor at our hospital and first floor. And we have services that we've never had before, including radiation therapy. Also, we have a cardiac catheterization laboratory that I'm proud to say has saved many, many lives. Those people who've come in for preventative procedures and those people who have come in with an acute episode like a heart attack. Also, we're a New York State designated stroke center, and we are a breast imaging and bariatric surgery of excellence. Just want to remind everyone, we are in the middle of a pandemic, but we want to remind you that our hospital is safe. Our medical group practices are safe. We've instituted a number of protocols to ensure that everyone can access care without concerns about getting sick. And we've instituted those protocols for your safety as well as the safety of our staff. NewYork-Presbyterian Lawrence Hospital is committed to caring for the community in a number of ways. We participate in community events, we offer health screenings. Recently, we donated more than 105 bags of food to a local homeless shelter for the Thanksgiving holiday. Also, we want to remind people that we offer charity care. And what that means is if you're struggling financially and you're not sure you're able to pay your hospital bill, we don't want you to not come in for care. We do have financial aid available, and details about that charity care can be found on our hospital's website. And as an FYI, a lot of that information is available in multiple languages. Now, on to today's speaker, which I was trying to tell you about a little bit earlier. Alyssa Klein. Alyssa is a senior physical therapist at NewYork-Presbyterian Lawrence Hospital and works in the physical medicine and rehabilitation department. Therapy from Quinnipiac University. Her areas of specialty include orthopedics and inpatient rehabilitation. Alyssa says what she enjoys most about her job is, quote, watching my patients return to the healthy life they want to live. Knowing I had a small part in helping them recover is special, rewarding, and provides me the motivation to get out of bed every day to help my patients. I love my job, end quote. So Alyssa, thank you so much for being with us today. And without further ado, let's hear from Alyssa.
Thank you, Alyssa, very much for that introduction. And thank you, Krishna, for the invitation to speak to you and your staff. The University of Minnesota did a survey and a study on how many people are now working from home. 42% of the United States labor force is now working from home, and 33% of people are not working and they're at home. That's 75% of the United States population is home. 25% are going to work, mostly essential workers, frontline workers, but a lot of those people are also sitting at computer desks all day, like you are if you are working from home. So the survey asked, since you have been home, what have you been doing more of? 71% watching TV, 56% cooking, 45% using social media, 43% eating. How many people said exercising? Not even enough to make my survey. So my job today is to try to get you to exercise just a little bit more. So if they survey you, you can be one of the people that say, yes, I'm going to be exercising. I'm going to be on that survey. So you're home. Where are you spending your day? Are you at a computer desk most of the day? Is that what you look like at the end of the day with your necks jut out like that? Or maybe you prefer a different relaxed posture. Any bets on how long it'll take before his rear end goes numb? How about this guy? This is my favorite guy. He thinks it's okay because his hand is holding up his head. So what are the best chairs to get to work from home? What is the best desk chair? Well, there's a lot on the market. You can go on Google and, best ergonomic chair, whatever. But the bottom line is it doesn't really matter. As long as you sit properly and you obtain the proper posture sitting at your computer. What is the proper posture? Let's go through this piece by piece so that you can have an idea of how to properly sit. Your monitor should be about 18 away. So put your arm out in front of you. That's approximately where your computer screen should be. Your eyes should be level with the top of the monitor. If you have a laptop or a lowered computer, consider putting it on a monitor stand. I use an encyclopedia at home, and I put it right underneath the base of my computer so it's up a little bit higher. Keep your shoulders relaxed. How many of you find your shoulders like this after 20 minutes at a computer? Keep your elbows bent to 90 degrees, close to your body. Keep your wrists neutral and about 4 to 6 inches onto your desk so the wrists are not hanging off the desks and you're like this onto your mouse. Make sure you have adequate back support. You want the back support to naturally contour your spine. You don't want to be jutted forward too much. Chairs that they sell online all of them come with a back support, but you need to make sure that's proper for you because everybody's spine curves a little bit differently. You would like your thighs to be horizontal to the floor, your knees bent to 90 degrees. Your feet should be flat on the floor. If you are shorter and your chair is higher, get a footrest or a stool so that your feet can sit flat on the floor. Don't cross your legs. Crossing your legs will compress arteries and veins, and it will cause poor circulation throughout your legs. And keep your key objects close by. Keep your phone close by. Keep your phone charger, your pen, so that you're not reaching across your desk for your highlighter, your nail file, or things that you use frequently when you're sitting. And also you want to avoid a screen glare. Consider where the light source is coming from in your house. Is it behind you? Are you going to have a glare on your computer causing you to go like this and squint and jut your neck forward? So you can buy like a screen protector or a screen glare monitor to help you prevent some of that backlight. So now you have this perfect posture, right? You're sitting and you're moderate sitting, which is considered about 4 to 8 hours a day. That's a long time to sit down. And I'm sure most of you working from home hit that 4 to 8 hours a day. Can increase the risk of, here we go, diabetes, heart disease, cerebral vascular accident, CVA or stroke, deep vein thrombosis, a blood clot, which can lead to a pulmonary embolism, blood clot to your lungs, hypertension, high blood pressure, high cholesterol, and obesity, which all can lead to, okay, we still want to sit? No, we're going to get up now, right? Number one question that I get asked, okay, right, so I said, I understand, I have to get up. How often should I get up? I exercise first. The CDC recommends 30 minutes of moderate intensity exercises a week. So this is not getting up from your computer. This is jogging or bicycle riding or, things like that higher intensity exercise. Getting up from your computer is not going to count, but it will give you more energy once your workday is over to exercise later in the day. There's a lot of variability and research about the frequency of standing, walking computer breaks, but everyone can agree on one thing. Frequent short breaks are better than one long break. If you learn anything from this presentation today, it's the next point that I'm going to make. Stick with this. It's the 20 to 8 to 2 office rule. For every 30 minutes that you are at your desk, 20 of them should be spent sitting down, 8 of them should be spent standing, and 2 of them should be spent moving around in every half an hour. I get it. There are times when you get into your work and you're working on a document and 45 minutes goes, oh, I forgot to get up. Blah, blah. I get it, right? This is life. My goal is to have you do this so much that it becomes habitual to you. And you can continue to stay healthy throughout the day. And after 20 minutes, you say, wait a minute, I've been sitting too long. I got to get up. I got to start to move. How can I remember to do this? That's very frequently throughout the day. Okay, well, let's use some technology to help us. Set an alarm on your computer. Everybody's got a phone these days. Set an alarm on your phone every 20 minutes. That's going to go off. You're going to get up. You can wear devices like the Apple Watch or the Fitbit that will literally buzz on your wrist to remind you, oh, it's 20 minutes, got to get up. Stand up to reach objects that you use frequently. I have a printer. I print a lot of stuff throughout the day, but my printer is not in my office. And I did that on purpose. I put it out into the hallway so that I have to get up and get the stuff that I print out of my printer. Don't put it right next to you. Put it in the room next door. Use an earpiece. I think you can all see Krishna, or saw him before. He was wearing earpieces, headphones. How many of you hold the phone like this when you're on the phone? How long before you get a neck ache? Invest in earphones, earplugs, and suggest walking meetings. You have a meeting, okay, well, I'm gonna go outside, I'm gonna walk around, let's walk together. You know, this way you're not sitting at your computer like this with your phone all day. Drink water. What does drinking water force you to do? Get up and go to the bathroom. So keep your water bottle close to your desk, drink as much water as you can so that you have to get up to go to the bathroom. Don't eat lunch at your desk. Eat lunch in the kitchen. Eat lunch outside. Go into a different room. Get up off of your working station. Have your lunch in a different place. Get a partner. Get competitive. My husband and I are friends on walking apps and running apps, and we compare at night. How many steps did you do today? Oh, really? Well, I did 4,000 more steps than you did, and you'd be surprised. It brings out your inner competitive nature, and it's effective. It really works. And are you finished with your day? Is the workday over? Stay away from your computer. Go into another room. It's recommended 30 minutes before bed that you turn off all electronics. It'll help you fall asleep faster. So put your phones away, get away from your TVs, get away from your computers, and let your mind rest before bed. Probably the best tip to try to stick with this 20 to 8 to 2 rule is, they are worth it, although sometimes a little pricey, is to invest in a standing desk. What standing desk is the best for you? Again, same answer as the office chair. It doesn't really matter. There are some that you can put right on top of the desk that you have already, and then there's some that are just a huge standing desk. It will much easier allow you to maintain the 20 to 8 to 2 rule much easier if you can just stand up and your computer comes right up with you. Where else do you work? Where else do you study? You work on a couch, the incredible sinking couch. Anybody look like this at the end of the day? This is a lady watching TV. She's friends with the other guy who thinks that it's okay to hold up their head with their hands. And this is the most common posture that I see with my children on their bed with their books in front of them, holding their head up with their wrists. No, get your kids up, get them in the proper position to sit, do their homework, and make sure that they have all of that proper posture that you are also going to. But I mean, kids are sponges. They're going to soak it all up. If you look like normal, if you look like what the slide I showed you before, your kids are going to look like that too when they're sitting, when they're studying. Set those habits early for your little young ones. Yes, it is okay to sit on the couch. I promise I have a couch at home and it's okay, and I do sit on there a lot. As long as you sit properly, you want to avoid the couch slouch. Very, very easy to slouch on couches because couches are soft. Avoid the soft couch cushions. Opt for firmer couches. Okay, well, I'm not going to go out and buy a new couch. No, I'm not telling you to do that, but go and find a harder cushion that you might have, like maybe on your dining room chair. Go upstairs in your pantry, in your closet, and find a blanket and fold a blanket, stick it underneath the couch cushion or behind you. The greatest things about couches is you can just keep adding pillows until you look like the lady on the right versus the lady on the left, and your spine is in much more alignment. Again, we talked about crossing your legs. Avoid crossing your legs for circulation purposes. And if you recline on the couch, usually people have their couches set up in front of the television, right? So if you lay on the couch and you lay on your back, unless your television is on the ceiling, you're going to have to turn your neck completely to one side in order to watch TV. So if your couch is positioned in front of your television, lay on your side. Put your pillow in between your knees, put a pillow underneath your neck so you're supporting your neck, and switch sides. Go back and forth on either side of the couch so that you don't wind up with a stiff neck or sore back. Okay, let's talk a little bit about mental health. While I was researching this presentation, I stumbled across this statistic, which was flooring to me, and albeit quite sad. According to the University of Minnesota, COVID-19 has tripled the rate of anxiety and depression since June. Since June, that's 6 months. It's an incredible amount. It's unbelievable. Isolation, bereavement, fear, it all contributes. Well, what can exercise do? There are a multitude of studies that prove that exercise is just as effective, if not more effective, than the use of antidepressant medications. Exercise releases endorphins, which is the body's natural antidepressant. It releases serotonin, which is going to make you feel better because it's going to lift up your mood. It increases blood flow to your brain, and it decreases boredom. It gives you something to do, so you're not sitting around thinking about how anxious or depressed you are. It's really very, very effective. You don't need to go to the gym. You can do these exercises at home. I'm going to take you through some of the exercises that I prescribe most frequently for people that are home without gym equipment. You don't need any equipment for any of this stuff. Just want to go through a couple of things first, a couple of disclaimers. Always consult your doctor or healthcare professional before initiating any exercise program, small or big. Maintain a balanced diet. Drink plenty of fluids throughout the day so that you can maximize your muscle fiber recruitment. Never exercise if you experience pain. This is a common misconception. People think no pain, no gain. I'm going to push through it. That's not true. Listen to your body. If something is hurting you when you are exercising, then stop. Don't push through that. And don't hold your breath during an exercise. A good way to prevent this is to count out loud. So if you're doing repetitions of 10, 1, 2, 3, if you're counting out loud, if you're talking, you're breathing. So I'm going to take you through a couple of these exercises. Copies of these exercises are available at the end of this presentation upon request. Just let us know. And we're going to start with posture, right? So we're all sitting at a computer. Our shoulders are rounded. Everything is forward. What's the best exercise to do? Shoulder retraction. So I encourage you, you're all sitting at a computer. Let's try some together. All right, I'll take you through, I will describe it to you and you can practice while I'm taking you through the exercise. Okay, so you're gonna sit, uncross your legs, put your feet flat on the floor. Sit with your shoulders down. Your head is neutral, that means wherever it falls. Bend your elbows to 90 degrees. Keep your elbows inside towards your side. And you're gonna move your forearms backwards and parallel to the floor and squeeze your shoulder blades together. Hold for about 3 seconds and relax. Make sure not to hike your shoulders up like this while you're doing it. It's a common compensation. Pretend like you have a little walnut in between your shoulder blades. Go ahead and crack that nut, hold, and relax. Okay? Any exercise that I'm going to teach you today, I'm going to tell you to do 10 repetitions, then take a rest and do that 3 times. So I'll say 3 sets of 10, about a minute rest in between. So what does this do? It helps strengthen your back muscles to correct our slouching posture. Next, chin tucks. You're going to sit or stand with your shoulders down and a neutral head. You're going to look straight, take 2 fingers, put them on your chin, and you're going to slightly tuck your chin and attempt to bring your head back. Don't tilt your head down as if you are nodding. That's the wrong exercise. Imagine you're trying to give yourself a double chin. You're going to hold for 3 seconds, and then you're going to come back to neutral. You're going to come back, give yourself that double chin, and come back. When we try to strain into the computer and we look forward, that is the opposite, right? We're jutting our necks forward. We're putting our neck exactly back where it's supposed to be. Give yourself that double chin, and it's going to prevent with forward head posture. And a lot of patients that I prescribe this exercise to say that it helps with headaches as well. Because when you're in this forward position all day, you get pain and headaches, especially in the back of your head. Okay, the next one is a stretch. It's a posture stretch. You can do this in the doorway. You can do it for both arms, or if your door is really wide, you can just do it on one arm at a time. So you're going to stand in a doorway, staggered stance if you'd like. 1 foot in front of the other is preferable. You're going to lift your arms so they look like this. Your upper arms are parallel to the floor. You're going to bend your elbows to 90 degrees. And you're going to slowly lean your body weight into the doorway, allowing you to feel a stretch in your pec muscles, in your chest muscles. Now, this is a stretch. This is not 3 sets of 10. Any stretch that you do should be held for about 20 to 30 seconds, and you're going to do it 3 to 5 times. You will feel all of these from sitting with a slouch posture, that this is one of my favorite exercises to do. Just let that open up, let that chest open up. Then take a deep breath when you're done. You'll see how better you can breathe as well. And like I said, it's going to help to lengthen the tight chest muscles that are associated with prolonged sitting. Okay, another posture stretch, upper trap stretch. All right, you're going to sit with your shoulders relaxed. You know, reach over your head with your right hand and grab onto the left side of your forehead, your left temple. You're going to slowly bring your right ear to your right shoulder, give it a little pull until you feel a stretch in your left upper trap muscle right here. You can take your left hand and put it behind your back. You'll have a little bit more of an intense stretch. And again, this is a stretch. You're going to hold 30 seconds, and then you're going to relax. And then you're going to repeat it on the other side. So just switch your arms, left ear to left shoulder, give it a little pull, feel that stretch, 30-second hold, and relax. This stretch helps to stretch the tight shoulder muscles, the upper trap shoulder muscles that are associated with hiking your shoulders up like this too long. This is where we keep a lot of stress, right, in these muscles up here, but nobody has stress, right? Oh, no, nobody has any stress. Okay, another stretch. Let's move down to the lower body. This is my all-time favorite stretch. You're going to do a kneeling hip flexor stretch. I know it's kind of hard for you. If you'd like to practice, you can get up off your chairs now and do it. But it's kind of hard to watch the computer as you do this. Okay, kneeling hip flexor stretch. You're going to kneel with your left knee on the floor and your right knee at a 90-degree angle in front of you. Take your hands, put them on top of your right knee, and gently lean your body weight forward into your right knee and hip. And you're going to feel the muscles in the front of your left thigh stretch. Why do these muscles get so tight? Because you are sitting all day. And when you are sitting, your hip is bent to 90 degrees and those muscles are shortened. And so we are trying to increase that angle and stretch out all of these tight muscles in the front of your thigh. Again, it's a stretch, 30 seconds hold, repeat on each side. All right, let's talk about some exercises again. Let's go back to lower body exercises. So let's talk about squatting. You're going to place your feet about shoulder width apart. You're going to squat down, bend your knees as much as you feel comfortable. Don't go into any knee pain, right? Very common place in our body to have arthritis are our knees. So if we dip down too far, we can cause some pain. Again, pain-free. Just as if you were going to sit in a chair, hold for about 1 to 2 seconds and then come back up. Don't go greater than 90 degrees and try to keep your heels on the floor. You can also do this exercise against a wall. It's kind of like a wall sit and slide against the wall if you're worried about balance or you want to make sure that you keep your back straight. That's another variation of this. And the targeted muscles are your glutes and your quads. And it'll help get those muscles nice and strong. So this is an exercise. So we're going to go back to our 3 sets of 10. Okay, lunging. I think we've all probably lunged.
Alyssa, if I could hop in for a second with a question. Is there an alternative to the knee flex if one cannot get on the floor to kneel on their knee? So going back to the hip flexor stretch.
Absolutely.
What do you do if there's knee issues?
You can do it off the side of your mattress. If you lay on your bed and you hang one leg off the side of the bed, generally the force of gravity itself will be enough of a stretch to stretch your quads and your hip flexors. If
that's laying on your back?
But laying on your back, letting one leg dangle off the side of the bed and then scooch over to the other side of the bed and repeat it with the other leg. If you need more of a pull, you can tie like a sheet or belt on the bottom of your foot, and you can hold it with your hand and you can kind of pull up so you can increase the bend of the knee off the side of the bed, and it'll have a more of a stretch in the hip flexors and quads. So you don't have to get on the floor.
Thank you.
You're welcome. Okay, lunging. Stand tall. You're going to start with your feet together. Then you're going to step forward with one foot until that knee reaches a 90-degree angle. You do not have to hit the floor with your opposite knee, to your point before, Krishna, if you have knee problems and you can't kneel. And then you can just push yourself back up to upright with your front lunging leg. Again, an exercise, so we hold about 1 to 2 seconds, 3 sets of 10. Some people alternate right foot, left foot, right foot, or 10 on the right, 10 on the left. It doesn't matter, whatever you feel more comfortable with. Again, this is going to target your glutes and quads. You get a little bit of hamstring activation as well with the lunges. Okay, let's talk about our calf muscles, a very, very neglected muscle in our body. You never see anybody at the gym working their calves, very rarely, and it's one of the most important muscle groups in our body. So I always prescribe calf raises. Very easy, just make sure that when you do a calf, make sure when you do a calf raise, you're holding on to something like a countertop or a chair for your balance. You're gonna rise right up onto your tippy toes. You're gonna hold 1 to 2 seconds. And then you're going to relax back down. A little more advanced is if you wanted to do this off the side of a step, so that when your feet come down, you get a little bit more of a range of motion when you go through the exercise. But that is a little more advanced, and you'll feel it. They're tough to do. The gastrocsoleus complex are the muscles in your calves, and probably one of the most important muscle groups in your body. Very important exercise that most people neglect. You can also do this exercise when you're sitting down with your feet on the floor. You can rise up onto your heels, and then you can rise up onto your toes and rock back onto your heels. You will not get the same strengthening effect as you will if you rise up against your body weight, but it will combat blood clots. It will help to increase the circulation of your blood while you are sitting doing your computer work. Ankle pumping exercises I prescribe to every patient that I see, and it's the only exercise that I say you don't have to count how many you do. Don't do 3 sets of 10, just keep doing them. An ankle pumping exercise, you can't do too much of it, and if the idea is to do it so much that you do it when you're falling asleep, or you do it when you're watching TV and you don't even realize that you're doing it. It's a very beneficial exercise for blood flow. So a variation on this that you can do when you're sitting down. All right, let's go to our arms. I hate push-ups. I'll be the first to tell you I probably could do 2 of them and then I fall over. I am not good with push-ups, but I can do wall push-ups, much easier. So you're going to stand about 1.5 feet away from the wall, place your palms shoulder width apart. You're going to bend your elbows and you're going to lean your body into the wall. Most important thing about doing wall push-ups is to not let your back or hips sag. It's very easy to let your whole body kind of sag into the wall. So keep the muscles of your stomach tight so that when you come in, it's a controlled descent and a controlled back push-up. Don't let anything sag down. Great exercise because push-ups target a whole slew of muscles. Your pecs, your triceps, your biceps, your deltoids, your serratus, which are the muscles over here in your sides by your rib cage. Very, very effective exercise, but don't ask me to get on the floor to do 1 single push-up. These are the ones that I'm going to do instead. And it's just as effective. Okay, we're going to go through 2 more exercises. Let's talk about abdominal muscles, the core. Let's start first with crunches. You're going to lie on your back with your knees bent and your feet flat on the floor. You can place your hands in 3 different places. You can go behind your head, you can cross them over your chest, or you can put them on top of your thighs. You're going to curl up towards your knees, but you're not going to come up that far. You see people crunch up all the time. They come up all the way down, all the way up. You don't have to do that. Just get your shoulder blade off of the floor just a little bit and then come back down. You are going to recruit the same amount of muscle fiber if you get your shoulder blades off the ground and come back down than you are if you come all the way up and then you won't hurt your neck. Same deal. 3 sets of 10. Hold for 1 or 2 seconds and then lower back down slowly. To get your obliques, to get the side muscles of your stomach, you can bring your elbow to your knee, opposite elbow to opposite knee, and you'll activate the obliques for lateral abdominal contractions. Okay, last exercise is the very advanced for your core and stomach muscles is the dreaded plank. So how do you plank properly? You're gonna place your forearms on the floor with your elbows underneath your shoulders, and you're gonna rock back onto your heels, onto your toes. You're gonna keep your toes on the ground. You're gonna squeeze your glutes and your abdominal muscles to stabilize your body like a board, like a plank. Make sure your head is in line. Don't let it drop up or down. And you're going to only start with 10 seconds. And that's probably going to be easy, and that's fine. The next day, do 11 seconds. The next day, do 12 seconds. Increase daily until you notice that your form is compromised. If you start to sag in your lower back, in your hips, if your arms start to shake, stop. And you know, okay, I'm about at 30 seconds. I can do that a couple of times a day. This is going to target not only the rectus abdominis, which is the outside muscle of your abdomen, but it's also going to target your transverse abdominis, which is a deeper muscle, which attaches directly to your spine. So you can get more abdominal muscle recruitment with the plank.
Alyssa.
Yes.
Are there any like progression versions of the plank that you would recommend, or would you just recommend starting with a shorter time? So is there any value to like an alternate way of trying it out if you're struggling to get the first plank?
So planking is tough. I would tell people start with the plank and increase your time as the progression. Once you master the plank progression, you're doing a minute, you're doing 2 minutes, and it's easy, then you can start moving within the plank. You can lift up one arm, you can lift up another arm, you can lift up a leg. That's advanced, that's very difficult. Yeah.
Is there anything for someone who would be who's struggling to get that first plank position?
Oh, I'm sorry, I misheard you. Yes, absolutely. You can do it, you can start with your knees down. You can have your knees bent on the floor, and you can do a plank that way. It's kind of like you've heard of, similar to the wall push-ups. It's not doing a push-up with all of your body weight. It's doing a plank with half of your body weight, so you can bend your knees and start that way, and then you can do one leg at a time and then another leg.
Thank you.
You're welcome. Sorry, I misunderstood your first question.
No problem.
Okay, so those are the exercises. I just want to talk quickly about one more thing, and then I'll take some questions. Let's talk about shoes. I know people who haven't worn shoes in 8 months because they've been home. Why? I'm not going out. I don't need to wear shoes. Oh, how wrong you are. Our feet were designed to walk on earth, which is softer and much more forgiving than even carpet is. But most of us have hardwood, tile, combination of carpet in our house. So if you're at home all day, it is recommended that you get a pair of indoor shoes. Don't do exercises barefoot. Couple of exceptions to that. If you're doing a yoga or a Tai Chi or more stretching, that's okay. But if you're going to be doing any sort of strength training, squatting, planks, put on a pair of shoes. Your feet will be much more supported when you're walking around, because you're all going to do the 20 to 8 to 2 rule and walk around your house now. Put on some shoes. Wearing shoes also decreases your risks of slipping and falling. So think socks on hardwood floor and little old ladies, right? Whoop, down you go. And then they come see me because they have a hip fracture. Wearing shoes will decrease your risk of slipping and falling. Please, for sanitary purposes, please, I have kids at home too. Don't wear the same shoes inside that you wear outside. Just get yourself a new pair of shoes. You don't want to track in any mud or anything like that. And then I get this question, what are the best shoes? And the answer is the same as the ergonomic chairs and the standing desks. It depends on your foot. It depends, do you overpronate? Do you have flat feet? Do you supinate? If you have a podiatrist, or you can even go see your PT, they can do a quick analysis of your feet and tell you kind of which brand to look out for if you go shopping in the stores. Okay. So my last slide, I always end every presentation with a picture of my children. This is Ava and Jade. These are my girls. We ran a 5K in September. So I'm showing them off a little and telling everybody, yes, you're never too young to exercise. That is my name and my New York Presbyterian email address. So I'll leave this up for a second. You can jot that down. I will also enter it in the chat later on. So if you have any questions that you don't feel like asking on this forum, then please feel free to email me. Check my email all the time. We have 2 locations for our physical therapy outpatient clinics, one in Eastchester and one in Scarsdale, both on White Plains Road. If you would like to be evaluated for physical therapy, give us a call and we'll take you through the steps of how to do that. We offer physical, occupational, and speech therapy. And now it is time for questions. I'm going to stop sharing so that I can see you if you ask me a question. Okay.
Right, so if
Did we just lose him?
Krishna, you froze. We don't hear you anymore.
nobody else has questions yet, I have one that I could.
Okay.
Can you hear me now?
Yes.
Now we can.
Okay, I think I had a little internet hiccup. It says my connection's unstable here. Okay, so something like a stretching band or foam rollers or things like that. Is there any need to get something like that?
I mean, yeah, you can do a lot. I love foam rollers. I have a few. Yes, the idea is, to try to do these exercises without any fancy equipment. Foam rolling is great. You can do that to loosen up tight soft tissue. You can also lay on top of a foam roller and then do kind of that doorway stretch with your arms back behind you. That'll open up your chest muscles a lot. I like foam rolling, and the stretching exercise bands are good too. Each color comes with different resistances. You can tie them on a doorknob. You can do arm exercises. You can do leg exercises. So there's a multitude of things that you can do with those resistance bands as well. Yep.
Wonderful.
I have a question.
Go ahead.
I have a question.
Yes, go ahead.
Alyssa. What are your feelings, pro or con, about knee braces when you're walking? The things you get in CVS.
Sure. They're not going to do too much to support the internal structures of your knee. They will help decrease swelling if you have a lot of swelling. There's a lot of research about the placebo effect of wearing a knee brace. So I'm not totally against it. If you want to get one and put it on and it makes you feel better, great. It certainly will decrease your swelling. And if you think it helps you, then I'm not against it.
Thank you.
And Alyssa, similarly on that, oh, go ahead, Steve. Do you have a question? You have to unmute yourself. Oh, we don't
Steve,
hear
you're
you.
still muted there.
Muted.
That's me.
There you go.
There
There we go.
it is.
Okay.
There you go.
I'll do a little plug for a friend of mine who has a company called Dynamic Movements. She has a little device called Stretchies, and they use it a lot now in yoga and Pilates classes. And for those of us of a certain age, it's sort of a lycra spandex fabric, and you can put it around your neck and around your feet, and it allows you to feel totally supported while also getting some really great stretch. And for me, I've got some back issues and other things. It allows me to do a lot of good stretching motions that I need to do while feeling supported while I'm doing them. So the product's called Stretchies. You can find it online. It's great. I love it.
All right. Thanks for the tips, Steve. I'll check it out.
Any other questions? Feel free to unmute yourself or put those in the chat.
I have another one about standing desks.
Yes.
So luckily at the beginning of the pandemic, I was fortunate enough. I went to my office and I borrowed a standing desk that just sits on top of my normal desk here at home. But you mentioned the 28-2 breakdown before, with 8 minutes of sitting for every 30 minutes. Is there an 8 minutes of standing for every 30 minutes? Is there an upper limit to standing? So for instance, sometimes I'll start a meeting or a presentation like this with my desk in the standing position, and I leave it standing for like 40 minutes to an hour. is that a bad idea in the long
No,
run?
it's not. You're going to
Okay.
listen to your body then. Yeah. Your body's going to tell you, oh, wait a minute, my back's a little sore. I got to sit down for a few minutes, or my leg is cramping. But no, there's no upper limit for standing. If you can stand for 45 minutes, good for you for not having to sit for that length of time. Yeah.
Well, I also have I have one of those like anti-fatigue pads. So I think that helps a little bit.
Perfect. Yeah. No, that's great. That's great. Mhm. Good for you.
You were also talking about, end of night, turning off all of your computers. What's a good end of evening exercise just before you're getting ready to go to bed to sort of get your body to relax a little bit so you get into the right frame of
Good
mind?
question. Good question. I don't recommend any exercises before bed. If you're going to do anything for your body, it's going to be a stretch. So those hip flexor stretches, the neck stretches this way, you can try some Tai Chi or yoga, but it was the minute that you start to do repetition after repetition to get your heart rate up, you're not going to fall asleep because it's going to increase those endorphins. It's going to give you a little bit of an adrenaline kick, but the stretching will bring you down.
Got it.
Good question.
Alyssa, do you have any suggestions for those people who may have some back pain? They're not quite sure why, but could that be, could it be a stretch specifically for something like that that you can recommend?
Specifically for back pain.
Yeah.
So I'm hoping that now that everybody's going to get up from their computer all the time, they're not going to have any more back pain, right? So back pain is tricky because there are so many different causes for back pain. So I always am a little hesitant to give out a specific stretch for back pain because sometimes, curling your legs into you as you stretch out your back could be beneficial for some people and harmful to others. The flexion versus the extension. So if it's true back pain and it doesn't alleviate with these stretches that I've showed you today and the increase in frequency, then my recommendation would be call the doctor and come get evaluated professionally so that we can really fine tune what's going on in the back. But I'm hoping that, the people on this call today will have some of the back pain alleviated because they'll be up and they'll be moving and they'll be trying these, generic stretches.
Good point. Thank you very much for saying that. And I just want to remind everyone that Alyssa actually put together a PDF of those exercises. So if you're interested in those, you can email Alyssa or reach out to Krishna, or myself, and we can actually send those exercises so you can put them in your home office and use those on a regular basis. And I'm preaching to the choir because I intend to do the same thing.
Yes.
Yeah, I'll be sending those exercises out with the continuing ed credit certificates after this.
Terrific.
Any other questions?
Oh, let me put my email into the chat as well.
Okay. All right. Thank you so much, everyone, for joining. Something I didn't mention at the beginning that I'd like to mention now is the WLA Professional Development Awards. So that is something that we're offering again in 2021. The applications are indeed open. I'll send the link into chat and I'll share it after the meeting as well. Any WLA member is eligible for this. You don't need to be a library school student, but these awards can help you pay for a conference that you would like to go to or a professional development opportunity that you're looking at. Okay, so thank you, Alyssa and Alyssa, for joining us. And I think if people have follow-up questions, we'll they'll direct them to you.
Great.
And yeah, thank you so much for this information.
Thank you for having me. It was my pleasure.
Thank you, everyone. We appreciate you joining this afternoon.
Bye, everyone.
Okay. Bye.
Thank you so much.